and welcome to today's Career Exploration Series. Today we're going to be focusing on medical and healthcare services. And we're so glad to have each of you joining us today, whether you're here in the Zoom room or watching us on one of the social media platforms. My name is Jo Tuite, and I will be your host today. We have a really impressive panel with us, and I'm super excited for you to spend some time getting to know them and hearing what they have to say. They're going to be sharing with you information about their college pathways, their careers, emerging opportunities within the field, and so much more. And one of the things that I love best about this particular program is that you get to ask questions of the experts. So be thinking about what you want to ask them as we kick off with some introductions. Matt, would you start us off, please?
Sure thing. Thanks, Jo. My name is Matt Barrett. I was the Indiana Academy class of 1994. From the Academy, I went on to get a bachelor's degree from Purdue University. And then I did medical school at Indiana University and finished my medical training at The Ohio State, finishing a general surgery residency. So currently I'm a general surgeon in Newcastle, Indiana, which is a small town just about, I don't know, maybe 20 minutes north of the Academy. And married and have two kids. My oldest is at Butler, but he spent 2 years at the Academy and graduated from the Academy. So I have a little perspective both as a former student and as a parent. So.
Awesome. I guess I'll jump in here. My name is Kian Karimi. I'm originally from Indianapolis, Indiana. Did a kind of combination of public and private school. I went to the Sycamore School, then went to North Central High School, which is a really large public school in Indianapolis. And that's when I found out about the Academy. And I graduated class of 98. Went to Indiana University in Bloomington for undergrad, and then also IU Medical School after that. Then I started my residency in otolaryngology, head and neck surgery, and after that did a fellowship in facial plastic and reconstructive surgery. I'm now 14 years in practice, live here in Los Angeles, California with my beautiful wife and 3 children, ages 7, 5, and 3, and I'm really excited to be here.
Hey, good afternoon, everyone. My name is Emily Summers. I graduated from the Indiana Academy in 2002. I grew up in Lafayette, Indiana. My dad was a professor at Purdue. And yeah, after the Academy, I went to Indiana Wesleyan and got my Bachelor's of Science in Nursing. And I graduated from there in 2005. So I've been a registered nurse for nearly 20 years. I've spent most of my career in different acute intensive care units and did a few years working in the operating room.
Great, thank you all so much for those introductions. We're now going to open things up for questions. So if you're here in the Zoom room, you can either drop your questions in the chat box to me privately or to everyone. And if you're watching on one of our social media platforms, you can place your question in the comments, or you can email it to me at the address next to my name on your screen. So you have 2 different ways that you can drop those questions as well. As you're thinking about what you want to ask of our panel, I'm going to kick us off with the first question that was submitted in advance. So panel, your first question. Anytime I mention that I want to be a doctor, people tell me horror stories about medical school and residency. Is it really as terrible as people say? What do you wish you knew before going to medical school, before residency, basically before becoming a doctor? That is a big question.
Wow. Maybe take that in chunks. Yeah. So is it as horrible? I think the farther away from training, the less you remember the horrible things. I mean, anything worth doing, you're going to have challenges. You're going to have parts that you don't, maybe that you don't like or love. But I would say if you're in the right spot, the things you love about it are going to far outweigh the horrible things or the tough times. And honestly, I think, just like being at the Academy, the harder it is and the times that you remember as being hard, you're surrounded by your friends that are going through it too. And you get this camaraderie. this shared like experience, and it makes it way, way more tolerable. Like as you move up that, chain of education, the challenges are shared, and you have more people around you of like mind, and you kind of find a little bit of strength and comfort in that and the people around you. So yeah, I think just like the academy is this, a place of learning and people kind of all doing the same thing and helping each other. You find that as you go through, your medical training as well.
Yeah, I guess I'll go next. So I have a kind of a unique perspective because I have, my memories of medical school, but I have a lot of medical assistants now that are pre-med, pre-nursing, pre-PA. So I get to, and I keep up with them. So I get to hear about what it's like these days as well. And I would agree with Matt. I mean, I see medical school and residency almost like military training, boot camp, and you kind of you get a lot of discipline. You get a core group of people that you trust, and that they depend on you as well, both physically, emotionally, psychologically, spiritually. I think the hardest part of medical school was seeing my friends who didn't go to medical school really start their lives and their
Mm.
careers, and they were making incomes, they were starting families, and I kind of delayed mine a little bit just because I was so focused on making sure that I achieved, good marks. I knew I wanted to go into a competitive specialty. And so that was hard because, in medical school, unless you have, really generous parents, you're pretty poor, and you're also digging yourself in the hole financially. I think the average United States medical student now graduates with about $250,000 of debt. And so that's a big staggering thing to take on. And physicians, these days, depending on your specialty, aren't considered, the wealthiest of the wealthy. Like you're not going to be, starving on $200,000 to $300,000 salary, depending on where in the country that you live. But it does take a while to pay those loans back. But again, I would do it all over again. I really love the experience. It's kind of like what the academy was. The academy was a big leap of faith to move out of the house at the age of 15 and be in a college campus. And that was a real, that it was one of the most crucial moments for me in my life because I had the trust and confidence of my peers, of my mentors, of the counselors, and of all the staff at the academy. And that I think really positioned me well for the following, rest of my academic career.
I guess I will weigh in as somebody who is kind of coming at it from the other side, where I did not attend medical school. I graduated with a bachelor's degree and was able to enter directly into the professional workforce. And yeah, I mean, I'm on the other side where I was able to start doing my job and making money. My student loans were all paid off before I was 30. Just a very different experience there in my training and my career, and then how that shaped what I do with my life in my 40s, and just a different kind of flexibility. So I think that's all for me there.
Great. Thank you all so much. Next question and this goes out to each of you, so any order you want. How did you decide on where to go to college?
I mean, okay, I can start. So I actually spent my freshman year at my dad's alma mater, Fairfield University, little Catholic Jesuit school in Connecticut. And I just thought I wanted to get out of Indiana and experience, something very different from the Midwest. And it was a great year, but it was not for me. And so then I transferred back my sophomore year to Purdue University. It was my roommate from the academy was an engineering program there, and so that's what kind of brought me there. We still roomed together at Purdue, and so yeah, another academy connection helped me figure that out. And I loved Purdue, had a great education. It really set me up, continued to set me up like the academy did, to continue a career in medicine. But yeah, I think it's important. You think what you want and what you're looking for, and once you get there, you can still make a change. Like you can assess how the school fits your needs and how you fit in there. And if it's not right, don't be afraid to kind of change and pivot and figure out what's best for you. Because yeah, you don't know until you get there, exactly what you're getting into. So yeah, be open to change for sure.
Do you want to take it, Emily, or?
Sorry, as I try to unmute there. Joe, are you sure you want me to tell this story?
Well, now you got me nervous.
And now we want to know.
I don't know if you remember this, Joe. I went to Indiana Wesleyan to follow my boyfriend from the academy. Now, to be fair, I did marry the boyfriend. That was 2003, so 21, a little more than 21 years ago. And a few kids later, we're doing just fine. But yeah, that practicum to do. But as Matt said, I think it is very important to attend college with an open mind and recognize that as big as the decision feels right now as your juniors and seniors in school, you're not locked into your college. It is not a life, it's not a, it is not a soul's blood decision that you are making, and you can make changes. And there are many, many colleges that offer quality education that will set you up for success.
So I was pretty set on not staying in Indiana after high school. I told my parents, I went and I interviewed at Stanford, Georgetown, I mean, all over the country. And then my father had gone to Indiana and also Indiana medical school, and that's all. I wanted to kind of distinguish myself. I didn't want to just kind of do the same thing. And then because I left the house, I was really young. I was all the youngest in my grade. So I actually moved to the academy when I was 15 years old. And my parents kind of missed me, and I was always really independent, and I became even more independent. And I got some scholarship offers in the state of Indiana, being a resident of Indiana. And so my parents said, well, look, you can go off to Stanford, you can go here, but if you stay at IU, we'll get you a car and a condo. And after living in a dorm, for 2 years, and the prospect of living in a dorm for another 1 to 2 years, I was basically bribed to stay at Indiana. So, but to Matt's point, I actually roomed with one of my close hallmate buddies from the academy, and we became best of friends, and we still are. And those are the connections that you make. I think in smaller environments like the academy, a little bit harder in college because there's especially at a big university like Indiana. And then in medical school, I made some of my other best friends from life. So that's how I ended up at IU. And actually, with my academy credits, I started IU as a second semester junior. And so I ended up doing 2 degrees and 5 minors, and still graduated in 3 years. And so I was a driven little guy, but the academy, because we were able to take not only the AP courses, but the college classes on Ball State. And so that really kind of gave me the opportunity to explore. I did a degree in Spanish, I did a degree in psychology, things that weren't just pure, medicine or pre-medical.
Yeah. Yeah, I think it's important too, because you're going to be, especially at a place like the academy that has exposure to all schools all over the country. Sit down and make a list of things that are important to you in a college before you even start looking at a college, because that can get overwhelming. If you make a list, and we're talking like geography, weather, even the silly things, like I want, not just educationally what you want, but like geography and some other things. Make that list ahead of time, and then you can get through a lot of schools really quickly, just crossing them off that list if they don't match those wants and needs. So it is overwhelming for sure.
I'll chime in too. I forgot to mention in my introductions, my oldest son is a senior at the academy this year, and doing the college search. So now we're coming at it from parents for the first time now, and not just from our own experiences. And we've insisted that Josh at least visit both the large state school environment and a small private school, because for all that you think that you know what you want, getting on campus and trying a few different atmospheres on is a very important part. You don't necessarily know what you want until you kind of see it live in action.
Yeah, good point.
Great, thank you all so much. Keon, you gave me an idea there. My daughter's planning to go to LA for college, but I hadn't considered bribery to keep her closer. So
Bribery
thinking
works.
about that.
Bribery works.
All righty. The next question, how did you decide that you wanted to go into the medical field?
Okay, I'll start. So my father is a physician, so I was always surrounded by medicine. But at the same token, he never said, "Hey, you have to go into medicine. You have to do this." I was just really inspired by it. And the moment I remember deciding I wanted to become a doctor was when I spent the day with him in his office. And he's an intern. He was an internist, but he also dealt with drug and alcohol addiction, addictionology, and he also did geriatrics. And I spent the day with him, and as an internist, he was mainly talking to patients, and the bond that I saw between him and his patients was something that I'd never seen or experienced before. There was just this level of kind of humanity, trust, and I mean, he was almost like a family member to these folks, especially in the primary care realm. And then I also saw the kind of like extremes of like the very elderly that were very sick in nursing homes, or of the the people with substance abuse disorders and the impact that it had on them and their families. And I was like, wow, this is like amazing. And then so I knew I wanted to be a doctor. I didn't know I wanted to be a surgeon. And then as soon as I got to medical school and I went to my first cardiology lecture, I couldn't stay awake. And I'm just like, oh my God, I need to cut things. I need to do things. And so you kind of know early on whether you're going to be a surgical path or the non-surgical path. But all along I knew that I was going to do something in the medical field. And I didn't really know how diverse the medical field was at the time. And it's even more diverse now with all the different specialties that you can go into. So once you've committed to being a medical professional, you have, I mean, so many options. And it all comes down, like Matt said, in terms of what fits your personality, what fits your interest. Do you like talking to people that are alive or not? Do you like looking at scans? Do you like doing procedures? Do you like the face? Do you like the body? Do you like the heart? It's kind of like, it seems very, simplified, but at the end of the day, that's what it is. And then you have to decide, like, lifestyle. How important is lifestyle to you? How important is it to take call or not take call? When do you want to start a family, plan a family? So all these things I think are key in terms of determining your specialty.
Okay, the next question I'm going to kind of build on, it kind of builds on what you were just talking about. So I'm going to go ahead and toss this out there. Emily, I saw you were unmuting to add to that. So I'm going to add this and then you can kind of maybe jump in on both pieces. But when in your college career, did you have to decide what path of medicine that you wanted to go down, or did you already know what you wanted to do as you went into college?
So I will jump in. When I was in early high school, freshman, sophomore, the career path that I actually had picked out in front of me was that of veterinarian. I had big plans of going to Cornell and studying veterinary medicine. And then I actually wanted to get even a little bit farther. I was looking at McGill in Canada, and getting a bachelor's degree from there, and then returning to the US to get my degree as a vet. But I ended up my time at the academy, I loved it, but it also left me not anxious to face down another 10 years of intense schooling. And I wanted something that would offer, oh, I apologize that Maps is talking to me. I wanted something that left opportunities for further education without having to commit to it right away before I could start a career. And then I also realized that I did appreciate the balance of interaction with patients that nursing could provide. I've certainly found as my career has grown, I highly appreciate being an intensive care nurse because my patients come with a highly varied degree of interaction. They're, sometimes they're very normal interactions, and sometimes my patients are on a ventilator and sedated, and there's not really any communication with them. And it can be the same thing with families. Sorry, I apologize for maps. I had settled into my nursing school degree when I went to college, and I started my nursing track my sophomore year.
So in terms of like choosing a specialty, like I think there's several checkpoints along the way where you can say I'm going in the right path or not. And so like, at high school, you're like, oh, for me, it was, I like a structured education. I like having like, steps to take to get to the end point. So medicine or in science in general was my career path. And then through college, taking different classes, things like that, doing some work in the medical field. I said, okay, yeah, medicine is the way to go. And then once I was in medical school, and I always tell people this, there were two things when I started medical school I knew I didn't want to do. I did not want to be a gastroenterologist, and I didn't want to be a surgeon. And then by the time I was halfway through my third year, the only two things I thought I wanted to do was be a surgeon or be a gastroenterologist. So you think you know what it's like, and you have a concept in your head like of things I can't do that, or I don't know how to do that. I don't want to learn how to do that. But keep an open mind, because like I said, once I saw surgery and I was in surgery, I was like, I can do this, and it's exciting, and that was it. I took off and enjoyed the rest of it. So there are checkpoints where you do have, some pathways will close when you make certain decisions throughout, high school, college, medical school, and even residency, because then you can do fellowships beyond. So like, just always be aware of what's around you, and, know that you, at some point you can make decisions, what path you could have.
Great, thank you so much. Next question. Would you say that your profession causes or involves a lot of stress?
Absolutely. I mean,
Yeah.
I think any medical professional, and the three of us happen to be in really stressful fields as well. I mean, the ICU is stressful. I mean, you're dealing with really critical patients, you're dealing with their families, you're dealing with a very intense situation. And I don't want to speak for the other two, but and as surgeons, I mean, we deal with some pretty stressful situations. I'm in a uniquely stressful field because I take healthy people and alter their faces for cosmetic purposes. Now, I used to, before I was purely cosmetic, I was doing skull-based surgery, so doing, brain surgery through the nose with neurosurgeons, flaps to reconstruct people's faces after trauma and after cancer. I did that for a long time, and then I kind of got burned out from that. So I went to the dark side, and now just do all cosmetic. But I have a totally different subset of stress now because it's elective. People are, no matter what you do, there's a very high expectation from us. And no matter how good you are, how good your institution is, things are going to go wrong. And as healthcare professionals, we do feel and empathize when people are hurt or not doing well, or or worse. So that's very, very stressful.
Mm-hmm. Yeah, for sure. I think if you don't want to have stress, then I don't know what career you go into. I think every career has stresses, no matter if it's in medicine or liberal arts or you name it. There's going to be a stress in your job. And I think the minute you're not stressed by certain things, then you probably need to not do that, because you need to care, and you need to take things on personally, and take it seriously, I guess. The things that stress me out now, 18 years into a career, are different than what stressed me out when I started, and they're fewer, I think, because again, you get used to certain situations, and You get comfortable and more confident in your ability and your skills, so you're not as stressed as you were when you started. But yeah, absolutely, you're going to be stressed. But that's the important thing. Like, and I think the academy teaches this outside of the classroom, is you have to have things that you do to relieve that stress, things that don't have anything to do with medicine. You know, I'm super active outside. I've got my kids, you know, and my wife, and things that we like to go and do things and relieve that stress. So, you know, those stress management skills you're learning at the academy, those are going to apply no matter what you go into. So pay attention to that for sure.
Yeah, I would agree with everything that has just been said. My job can be very stressful at times because it comes with a high degree of responsibility. All three of us here are in aspects of medicine where we are very much involved in life and death situations at times. And sometimes those situations don't end well. And sometimes maybe things could have been done differently that would have had a different outcome for patients and their families. And sometimes there's nothing that could have been done differently. And those are all pieces that we have to learn to live with. I think all three of us have been in our careers for upwards of 15 years. And that's something where everybody just kind of has to learn their own coping skills. But as you just said, I've said more than once that the time for me to leave my profession is when I just get home and say, I just don't care. When things don't bother you as a level of stress, it's time to walk away because it's not safe for you to practice anymore. Yeah, I think that's the end of my answer there.
So to Emily's point, actually, so part of medical education now that wasn't the case during our time is actually about this very subject, about balance, physician burnout, nurse burnout, healthcare, because what Emily mentioned, the loss of empathy is one of the biggest danger things that can happen to a medical professional. Also, the reality is, the rate of substance abuse disorders in medical professionals is higher than it is in the general population, because sometimes people don't figure out the actual right way to relieve that stress outside of the workplace. But now, I mean, any medical school that you go to, this is it's very much addressed, and folks are kind of taught that there is life outside of medicine, and that the balance is really important. Personally, working out is something that's really big for me, for my mental health. I do that anywhere from 4 to 6 times a week. And being present, with our children, we have like no phones policy at the dinner table, really limiting screen time, going on dates with my wife, all these types of things are super helpful and important for that balance. Otherwise, I would just be consumed by my profession all the time.
Those are great points. Thank you so much.
I'll jump back in and say one of the massive advantages, and this wasn't something I necessarily understood when I was 17 or 18 and looking at college options and future careers, is the degree of flexibility that my job would have in terms of not being consuming. I've been lucky enough to be part-time for a lot of my career, and especially since being a parent. And I think a huge source of my longevity in being a bedside ICU nurse, and a big source of, I love my job. Every time I think about going on to something else or changing it, I realize that there's really nothing else I would rather be doing. But a big source of that is the fact that I do get to walk away, and I don't have to be there hours upon hours upon hours. But also, yes, finding and identifying the coping skills, and the fact that my job allows me to have hobbies and a life outside. I have, you were talking about working out. I'm a running coach. I coach track and cross country at my local school. There was space in my life for my husband and I to be foster parents for years. So having things that, an entire identity that is fully separated from my career, has been a very important part of my own mental health and sustainability in medicine.
Thank you so much. The next question we have coming in is, can you share what your typical work day is like and what has surprised you most about the field that you're in?
Well, I can share my day. I might have to think about that surprise thing. So, but my typical day, it just depends on the day of the week. So, if it's an operative day, I'm usually at work by 6:30 or so, just to kind of prep for the day and look over cases and things like that. ORs start at 7:30. So as a general surgeon in a small town, I do some things like a lot of endoscopy, and then operative cases like hernia repair, colon cancer, breast cancer, gallbladder disease. So an OR day is typically anywhere from 7:30 in the morning till last case is usually around 2:30 or 3:30. And then it's up to the office to, answer patient phone calls and things like that, do office work. So home, 5:36, that's a typical operative day. And then the days I'm in the office, it's a little bit easier. You start a little bit later, you end a little bit sooner. And then obviously with general surgery specialty, I'm on call every third night. So, you're taking calls from the ER in the middle of all that. So you're trying to manage that. Then there's days we work in the wound care center, and so it's a lot of variety, and that's what I like. It's not the same thing every day. There is a rhythm though. I mean, I do try to keep things kind of similar week in and week out, but there's a lot of variety, and that's what keeps it fresh for me. And I'll think about the surprise thing.
So I guess I'll go. My day has changed quite a bit because I went from being kind of hanging a shingle to being employed to now being solo and independent again, but now running a business and being entrepreneurial and running multiple businesses. So in terms of my actual work day, so that typically starts anywhere from 5 to 5:30 a.m. because I have to work out before work to get that in. On an operative day, I'll get there between 6:30 and 7 a.m. I operate 2 days a week, well, really 1.5 to 2 days a week, Tuesdays and Thursdays. And then after the OR is done, then we'll go to the office and see follow-ups, pre-ops, injectable patients, whatever. And then Monday, Wednesdays, like Matt said, it starts a little bit later. And those days I like because I get to take my oldest daughter to school and be part of her little morning procession before heading to the office. No matter what, though, because now I have quote unquote control over my schedule, which is a little bit of a joke. I need to end by 5 or 5:30 latest because right now my kids are so little. I call it the golden hour where I get home, we have dinner, do the bedtime routine. And so that is so important to me. And actually that if I start like staying later or missing out on that, that's when I feel imbalance and that's when I feel stressed. I can handle all the stuff during the day. I can handle my picky patients. I can handle, 8-hour surgeries. But if I feel like I'm not doing the right balance of, fatherhood and doctorhood, that's when I get stressed out. Fridays, I did this about 3 years ago. It was one of the best things I ever did. I don't see patients. I have it as a personal day. And so I do, whether it's working out a little bit later or going to lunch with my wife or being involved with the kids' schools, because a lot of their events happen on Fridays, Thanksgiving at the school, Christmas at the school, whatever. I've been Santa Claus the last 2 years for my preschool. That happens on Fridays. So that's been really great. But I do also travel probably once a month, once every 2 months to teach because I do a lot of education, both nationally and internationally. So those Fridays are important because sometimes I'm gone, for 3-4 days in a row, or longer. So it's, and I love, to Matt's point, I love the variety. I love having an operative. If I operated all day, every day, I think I would get, I would get burned out, not love it. If I just saw clinic patients all day, every day, the same. So I think variety in medicine and maybe in any field, I think keeps you intellectually stimulated. And there's never really a routine. You try to make it as routine as you can because we like predictability. We don't like surprises. So I try to do things to not have surprises.
Yeah. Surprises are never good in the operating room. They're not always unavoidable, but they're never good.
Unless it's swag from your alma
Oh, right,
mater, from your school. That's a great surprise. But
right.
a surprise outcome or a surprise patient, no, that's not good.
Yeah. Yeah.
I look at my day as having anchors in it, because there's a part of my job that is predictable and proactive, and then there's a huge part of my job that is simply reactive. And I think you guys also share that. So there's certain things, I come in, I work a 12 to 13-hour shift, that is dependably relieved by somebody else with my same qualifications. So again, a little different than what you guys get to do, because at the end of the day, when I've done the amount of work that I'm able to do, I pass off that which I haven't been able to do to the next shift, and I get to go home. But a work day for me usually starts at 7 in the morning, a brief report, picking patient assignments, and then a more detailed, comprehensive report. In intensive care, our staffing ratios are either 1 nurse to 1 patient or 1 nurse to 2 patients. So I'm usually taking a report on 2 patients. Um, and then the anchors part of my days are assessing my patients and passing medications. There's other tasks that I know that I need to accomplish during the day for my patients. And again, a lot of that depends on what that patient situation is like. But then a big part of my day is simply reacting to the surprises that your patient has in store for you, or the things that come up that maybe you knew they were likely to need. And sometimes those are good things. Sometimes that's a patient who is breathing better and getting off the ventilator. And sometimes those are things that you wish were not happening, like your patient going into an irregular heart rhythm and needing to respond to that. A huge part of my job is collaboration with the different specialties, working with physicians. Oftentimes in ICU, it's multiple specialty teams, like the intensivists in general surgery, and maybe a cardiologist and an oncologist, infectious disease. But also working with respiratory therapy, physical and occupational therapies, sometimes palliative care or hospice. So collaborating those teams and helping the interpersonal communication there is a huge part of my job.
Thank you all so much. And I agree with you. Variety is definitely best in any profession. As a quick reminder to those that are just joining us, if you're here in the Zoom room and you have a question for our panel, just drop that into the chat box, either to me directly or to everybody in the group. And if you're watching this on one of our social media platforms, you can put your question in the comments, or you can email it to me at the address next to my name on the screen. So next question for our panel. Did I give you a chance to catch your breath for a moment? All right, your next question. How do you keep from letting patients' bad news or situations affect you?
Boy, yeah. I mean, that's a good question. If you don't have I don't want to say a bad outcome, but an unexpected outcome, then you're probably not operating enough. I mean, it's going to happen no matter what. I think the key is, number one, having good partners around you. Recently had, a unfortunate outcome on a patient, and just knowing that my partners were there to support me, help me talk it through. I mean, I think, going over and making sure, did I do everything correctly? Because even you can do everything absolutely correctly, and things can still go a different way than you planned. And being able to recognize that, work through it, ask for help, and then help guide the patient and their family through that outcome, I think is the most important thing. But surrounding yourself with, good people and people that you trust, and fortunately, I have 2 very good partners here that I lean on frequently when things get difficult, and it'll happen, especially in surgery. So.
I would echo that. I think a support system, just like how important a support system is in any phase of your life, it's especially important as a medical professional. And knowing when to ask for help, knowing when to involve other professionals. But on a human level, it is difficult to separate, the empathy from letting it affect you personally and taking it home. And personally, like when I was looking at different specialties, that's why I could never do like pediatric oncology, I was not able to like separate, for me, like the sadness and the tragedy of children with cancer. I just knew like I couldn't do that. But the people that do it, they're very empathetic, humane people, but they're able to separate that and see it for what it is. And we need people in that specialty, obviously, to care for our sick children. But it comes down to the mental, emotional health balance. And that's a really tricky part about our field, because you're not only dealing with the patient, but you're dealing with their families, you're dealing with their network as well. So it's a lot to take on, and it's honestly like something that all of us have to continue to work on, every single day. And sometimes as surgeons, like, and I see this very much, like we're almost like, most 99% of the times things go great, but you'll rarely see a surgeon like over celebrating like a great outcome, because we just know the very, because I was doing like this complex skull-based surgery with neurosurgeons, and the neurosurgeon was delivering the news like the patient had died, and we had a successful outcome. It's like, yeah, well, it went okay, and I was like, it went great. What are you talking about? It went okay, because we're just so, those surprises or those poor outcomes. We're almost like bracing for those, rather than just
Yeah.
over celebrating our wins.
Yeah. Oh yeah. I thought of this too this past week with this outcome, is that surgery is incredibly humbling. Like the minute you think you're doing great and you can take care of anything, you have an outcome that just reminds you that you are not in control all the time, and
Yeah.
things can happen. And yeah, super, super humbling, even at this stage of a career. So
Yeah, I think as I was kind of thinking of my own answer, that the number one way that you adapt to that is time and experience. Nothing prepares you
mhm.
for the very first time. You have to be the one to tell a family member over the phone that their loved one has died, or sit there with a doctor who says that there's nothing more that we can do. Nothing prepares you for some of those first experiences except doing them. And having excellent mentorship. You talked
Yeah.
about having partners and a support system.
Mhm.
I've been blessed to work with physicians and nurses and social workers with excellent skills in having hard conversations. But another piece of that, as part of just learning, is understanding that you can only control the controllables. And there is so much in medicine that we can't control. And so understanding what your own role is, and what you can and can't contribute to improve patient outcomes. Because there are limits to what we can do.
Mhm. Yep.
Great, thank you. Next question for you guys. How would you say AI is impacting your job now, and how do you think it's going to impact you in the future?
Matt, you want to take that, or
Well, okay, you start if you have an
okay.
idea. Yeah.
So, AI right now, and so I'm here in Los Angeles, and I recently went to the Google campus here in Playa Vista and heard 1 hour lecture on the head of AI, and I was equally excited and terrified, honestly,
Mhm.
At what AI can do. From a practical perspective, I think AI hopefully can help with decreasing medical errors in hospitals, which are still a big reason. I can't remember what number it is, but it's a pretty high number for patient deaths, from medication errors. So maybe, AI could be helpful there. And AI also is going to be integrated with some of the diagnostic modalities like radiology and things that, right now a human is looking at a scan, at an X-ray or at a CT scan
Right.
or MRI, and AI, I think, will really help detect things that the human eye may not be able to detect.
Yeah.
AI also, we've had robotic surgery for a long time, but I think AI may help kind of boost, robotic surgery. And in the extreme example, like let's say you need a specialized surgery, there's no one in your community that can do it, but someone in Europe or in Asia could actually do the surgery robotically from a remote location. And that's not a perfect thing, but it is happening. And you have to have the
Yeah.
local folks like, doing the setup.
Yeah.
In the business world, we're always looking for AI to optimize inefficiencies in terms of scheduling and paperwork and this and that and things that really suck a lot of our time and resources in the private practice world. So those are all the exciting things about AI. There's obviously the dark side of AI too, particularly in cosmetic surgery. We already have patients with dysmorphia. We used to call it Snapchat dysmorphia. Now we have like AI avatars and creating, and this really impacts our children too, particularly adolescents, creating unachievable and unnatural, ideals of
Yeah.
beauty and sense and self.
Yeah.
And so, there's a lot that is not great either.
Yeah, I'm getting ready to go to the American College of Surgeons meeting. So, and there's all kinds of things, being presented there that I'm looking forward to getting into, because I think we have no idea all the applications potentially in the future. I would say the one thing I feel like we use every day is pattern recognition. And I'm saying this as surgeons, we think about anatomy and all the variations in anatomy. So staying out of trouble in, like, say, taking out a gallbladder, knowing all the patterns that those bile ducts are arranged, is what you have to get good at to be a safe surgeon. Same thing with a radiologist looking at a mammogram. You got to recognize what's the pattern of a breast malignancy within that tissue so that you can catch an early cancer. And I think pattern recognition is one of the things that AI is already really good at, and as it learns from what we do, is only going to get better. So I think there's a lot of application in our field from that standpoint. So.
Great, thank you. If you were able to go back in time, what would you do differently in high school, or what would you keep doing? I love this question.
Ooh.
My only like regret or FOMO is that I was so driven and I was young for my grade and I went through college in 3 years. I never really I didn't study abroad. I didn't have a gap year or anything like that because I just felt like I was wasting time. And in retrospect, I think that having a gap year or having a year to do, not necessarily fun things, but like you can do a research year, it's like a self-development year, particularly between, when you're a teenager and when you're in your early 20s. I think that would have been, I don't know, maybe something that I would have enjoyed. And I was always mature, but I was so young. I mean, I started medical school at 20. And I think like it would have been, I don't know, something that would have been useful for me.
Yeah, I think maybe like, yeah, slowing down, and I was always kind of thinking like, I got to get to the next part
Yeah.
because I got to get to the good stuff. I got to get to the good stuff. And I think maybe recognizing like there's good stuff at every stage, right? And so maybe taking the time to enjoy that rather than looking ahead so far. I'm at Purdue right now. It's the 75th anniversary of the crew team that I rode for Purdue when I was here, and I'm seeing all these guys we used to row with and everything, and I'm like, man, there was some real good stuff at Purdue. And so like going back and appreciating at each step what's the good stuff here and doing a little bit more of that, I think, for sure.
Yeah, I think just enjoying the phase that you were in. I mean, I was another one. I was 15 when I went to the academy. I was 17 when I graduated. I graduated from nursing school when I was 20. I came out in 7 semesters thanks to academy credits and stuff. I mean, I could code my patients and push up an epinephrine before I could legally, buy alcohol for myself afterwards. And, I certainly don't regret those early, jumping into adulthood, early. And at the same time, yeah, take the electives, take the opportunities that come with youth, because they are harder to come by when you're, as you get older, and more settled into life and have different responsibilities. So yeah, just enjoy the opportunities, even if they don't seem to fit directly into your career plan. You never know how those experiences now will shape and turn into crucial parts of your identity when you are 20 years from now.
Yeah, well said.
I am actually going to share my screen with you very quickly. Maybe. There we go. So I'm showing a QR code on the screen, and I did just drop into the chat box for those here in the Zoom room a link. If you'll fill out this very, very brief form, I will happily send you some very cool Academy swag. So I'll leave that up on the screen for just a moment as I ask our awesome panel to share with all of you that are watching today, maybe their last thoughts, some words of wisdom or advice that they might have for you. Who wants to go first?
Well, I can start, I suppose. Yeah, so we occasionally will have like medical students and college kids come through the OR, and just like listening to what they're into and what they're doing. And I always tell them, try to see as much and do as much in whatever stage you're in. Try to see as much and do as much before you're the one responsible for it, because eventually, you're going to be the guy. Like if you're like ICU nurse in charge of a patient or a physician in the OR in charge of an operation, like eventually you're going to be the top of the rung on that ladder making the decisions. So you want to see as much, do as much, so that when you are responsible, you can remember, oh yeah, I saw how that was done, and that's how they handled that situation, and this is similar situations. So you build this experience bank up so that you're ready when that situation arises and you are in charge. So see it all, do it all. If you have to stay a little later, even if you don't think it's something you want to do, you never know, right? So see it, do it, see how other people handle it, and then that's your kind of database for the future.
I guess I'll go. So as someone who now hires kids that are in college that are considering careers in medicine, and I've done this, for the last almost 10 years, the feedback I've gotten from them now that they've all gone on to, professional school, was that it was one of the best years of their lives. So if you're able to swing it, whether you're third or fourth year of college, try to actually work in a clinic where you are involved with patient care. Because you'll see a perspective that you just cannot get from spending, just doing a shadow day or this or that. Like once you're like the one like greeting a patient and then hearing, like patients will, even if you're just a medical assistant and you're in college, they're going to treat you like a healthcare professional. And all of a sudden you're like, whoa, like this is a very different level of responsibility. And then you get to see, like, is this for you or not? And to Matt's point, seeing all the different types of specialties as much as you can, and finding mentors. That's, I think, one of the biggest blessings that I had along my way, was that I had the most incredible mentors in every step of my career. And if it weren't for my mentors, I don't think I'd be where I'm at today. And so that's why I've also now become a mentor to these younger folks. I'm a professor now at the University of Florida, and I bring residents out with me, to Los Angeles for different things and go give lectures. And so this sense of like wanting to give back happens, usually after about 10 years or so. The universities will start sniffing out if you're doing well, and they're like, oh, hey, remember us? you want to give some money? So but you don't have to worry about that for a long time, because they know that you're finally probably just paid off your student loans, so now they're going to hit you up.
Yep.
Yeah, I think the opportunities to give back is definitely one of the coolest things. I love participating with nurse residency programs, and treating and teaching new nurses, and helping ease some of their fears. I think the two biggest pieces of advice I would give you is if you're interested in the medical career, absolutely explore it. Absolutely consider all the things that we talked about. You know, do you want to interact with patients? Do you have strong empathy boundaries? Really struggle with some of those pieces. You know, be honest with yourself about your character and your boundaries, because that's the best way to set yourself up for a healthy long-term career. And remember that you're not necessarily locking yourself in forever. You know, for again, as big as these decisions feel, you can start something and decide and realize that it's not for you. I think there's a rule. I actually learned it for running, but I think it applies very well to life, of just kind of the rule of thirds, where about a third of the time, what you're doing will probably feel really good. You'll really enjoy what you're doing, and about a third of the time, it'll just kind of feel like, well, like it's another day, it's another job, another another couple hours worked. And then there'll be about a third of the time where you're asking yourself what on earth you're doing. And maybe that's a little rough on the career side. Maybe a third of really questioning yourself is too high. But it's just a good reminder that it's okay to not love every hour of what you're doing. And that doesn't mean that it was a bad decision or it's the wrong career. Just every job has those cycles and those ups and downs.
Great points and excellent advice, everybody. Thank you. I'm going to share my screen with you one more time. There we go. Well, excuse me, that did not advance right. There we go. Visit opportunities. So before everybody leaves, I want to invite you to join us for one of our other free upcoming programs. We have them both in person and virtually. So I've listed the remaining ones we have for October and given you a little sneak peek for the first couple that we're offering in November. So you can scan that QR code and check out the full list of all of the programs that we offer. Kian, Emily, Matt, thank you so much for joining us. I remember each of you when you were 15, 16-year-old kids, and it has been such a privilege to watch you not only as students here at the Academy, but then as you have grown up and ventured out into the world and done such incredible things. And I just thank you for allowing me to be a small piece of that. It's been a real blessing to watch you all. So thank you so much for joining us. And to all of our participants today, whether you're here in the Zoom room with us or watching on one of our social media platforms, thank you so much for joining us. Enjoy your day.